Hello, everyone. I'm Dr. Vijay Balasubramanian. I'm one of the pulmonologists. I'm the medical director for Valley Advanced Lung Diseases Institute here in Fresno, California. I'm also specialist in pulmonary hypertension and advanced lung disease. It's great to meet all of you. And here today, we are going to talk about understanding your pulmonary arterial hypertension symptoms. This presentation is sponsored and made on behalf of United Therapeutics. Speakers are compensated by UT. The information presented here is for educational purposes only and is not intended as professional medical advice. Always discuss questions you may have with your healthcare provider. Not all medications are appropriate for all patients. Please speak with your healthcare professional to determine which treatment plan is right for you. Today's overview of the presentation is basically in 3 steps. Pulmonary arterial hypertension, how does it affect your body? And PAH medications, how do they improve symptoms? And what can you do to help in this process? How does pulmonary arterial hypertension affect your body? Pulmonary arterial hypertension is a rare and a serious lung disease. The blood vessels within the lungs tend to thicken and narrow over a period of time. This makes it hard for the right side of the heart to squeeze the blood into the lungs. And therefore, it has to generate higher pressure in the blood vessels and therefore lesser blood flow within the lungs. The narrowed vessels and less blood flow affects different parts of your body. Obviously, the more common symptoms being shortness of breath and fatigue. And eventually, as the right side of the heart starts becoming more enlarged and strains and becomes weaker, then what we call the failing right side of the heart, then the swelling in the abdomen happens, swelling in the ankles can happen due to more fluid and water retention as a result of this high pressure that's generated in the lung circulation. And shortness of breath and chest pain may occur due to the body not getting enough oxygen. The blood vessels in your lungs are like highways. Here is a nice cartoon that illustrates how the blood travels within the blood vessels. When the highways work best with fully open lanes, you can see all the cars are running smoothly in their respective lanes. But when you see that there is a lane closure, you can see things backing up and the pressure builds up. And that's typically what happens within the blood vessels of the lungs. The narrowed blood vessels cause more resistance, and that is what we call or refer to as pulmonary arterial hypertension, which leads to less blood flow and therefore less oxygen transfer. The higher resistance in the lungs causes higher pressures in the heart, and the right side of the heart swells, enlarges, and therefore it makes it harder for the right side of the heart to push blood through these narrow vessels. The less blood flow through the lungs lead to less oxygen reaching the parts of your body where it's needed. So adequate blood flow and oxygen are important factors for normal bodily functions to carry out day-to-day activities. That is how a patient may end up feeling short of breath or fatigued when even doing daily tasks. The heart becomes strained over time. To compensate, the strained heart pumps more forcefully, trying to push blood through these narrowed vessels. And this can result in fatigue, lightheadedness. And the type of lightheadedness we see in pulmonary arterial hypertension is when patients engage in activity, meaning to say, the more oxygen a patient needs, that is when the strain is felt more and they feel more lightheaded because the body is just not able to compensate for the increased need. The strain on the heart can get worse over time, and this can lead to what we call heart failure. As the heart enlarges and strains, it won't be able to keep up and will begin to fail at some point. Patients can start feeling dizzy and can even faint with even some exertion. Now, that is why diagnosis of pulmonary arterial hypertension can really help because once we make the diagnosis and get the patients on appropriate PAH medications, that can improve the blood flow in the lungs and that reduces the strain on the heart. How do PAH medications help improve symptoms? Healthy blood vessels require a balancing act. Basically, you have certain chemicals that help to keep the blood vessels open, and there are certain chemicals that keep the tone of the blood vessels, meaning to say it has to remain in a good tone. A healthy balance between the two helps for adequate blood flow through the blood vessels. But when you have certain substances, when this balance gets tilted one way, there might be too much of some substances and too little of others, then you might see progressive narrowing of the blood vessels and therefore increases the blood pressure in the lung circulation. Most people have more than one substance out of balance. pH medications can help restore that balance. So can slow down the production of substances that you have too much of, or increase the production of substances that you don't have enough of. And please talk to your doctor about your treatment plan if you have stopped improving or still experiencing pH symptoms despite some treatment changes, because this is a dynamic thing. It'll constantly keep moving depending on each and every patient, depending on their status. pH medications can help traffic flow more smoothly. They can help widen the blood vessels in the lungs or open more lanes, so to speak. Now they can flow more effectively and it reduces the pressure in the process. The resistance to flow gets lower and the blood begins to flow more normally. The treatment guidelines recommend treatment with two or more types of pH medications for most patients. Again, just as we spoke about a couple of slides ago, most of the time patients can have more than one chemical imbalance, and therefore targeting at least two mechanisms can help improve outcomes. And what do we mean by outcomes? The improved functional class, improved ability to do more activity and feel less short of breath. And that is what is measured in the 6-minute walk distance as well. These type of improvements can be achieved with the help of this type of approach. So taking a combination of medications may improve how well you can do your day-to-day activities with minimal or less symptoms. The right combination is the one that helps you meet your treatment goals. And the treatment goal is something that you have to set along with your provider. And what do we mean by that? What we mean by a treatment goal is improving lung function, improving heart function, and improving symptoms. The treatment goals are very much set by yourself in partnership with your provider. So you and your healthcare provider will choose the type of medications that can best treat your unique PAH. What can you do? Take an active role by tracking your symptoms. Please be observant. Keep track of your symptoms in a way that works for you, such as a symptom journal is just an example, including activities that you can do without symptoms, activities that trigger symptoms. That way, when your healthcare provider asks you the next time, what are the challenges you're experiencing, you can be very succinct in telling what your challenges are. Please share your symptoms with your healthcare provider at each visit. And the dynamic nature of improvement or worsening can be assessed by yourself in this process. Not all cardiologists or pulmonologists have expertise in treating PAH. It's important to find a provider with specialized training in pulmonary arterial hypertension who has experience in using all classes of PAH medications. PAH treatment guidelines recommend working with a PAH specialist. To help you find a list of PAH specialists, you can refer to the Pulmonary Hypertension Association website, or you can scan the QR code, visit findaphDoctor.com. That might give you that information. Discuss your options with a PA specialist, such as adjusting your medication plan, adding or changing a medication, adjusting the dose of your medication. Please start making lifestyle changes, like starting an exercise program, changing your diet, such as limiting salt intake, and getting rest and emotional support is very important as well. There may be more you can do to help reduce your PH symptoms and do more daily activities. In summary, in PH, naturally occurring substances in your lung blood vessels can become imbalanced. The imbalances in the blood vessels prevent your lungs and heart from working properly. Treatment with a combination of medications may help restore this balance and improve PH symptoms. Talk to your doctor about your treatment plan. They may be able to do more for you. And obviously, you yourself have a great part in this. Thank you. Hope this information was very helpful. Consider joining the PH Initiative at jointhephinitiative.com. And you can also follow us on social media. Thank you.